Hello, you. Welcome to another fantastic episode of MorlaXorla. Today, we bring you one of the very most important and very educative um, stuffs. This month is a breast cancer awareness month, and our goal here is to help you understand what breast cancer is and how you can possibly prevent one. So you can share this video with your girlfriend. If you're a girlfriend, you can also share with your boyfriend so that he learn how to treat your boobs so that you don't suffer breast cancer. And because I'm not a health personnel, we are joined by one beautiful woman who is a health personnel, and I want her to introduce herself and tell us everything about herself.
My name is Patience Otoo. I'm a disease control technical officer, and I would like to educate you on breast cancer today.
Okay, so patient, apart from being a disease control officer, what else do you do in normal life?
I'm into bead making
Oh, okay.
and fashion. So anything regarding fashion and bead making, you can contact.
Oh, that's perfect. Do you have any social media account or?
Yes, Pep_agency on Instagram.
Okay, so from here you can look out for Pep_agency on Instagram. So let's dive right in quickly. Patience, tell us, what is breast cancer?
Okay, I would not like to scare our viewers with all the huge terms about breast cancer.
Sure.
I would simply say breast cancer is an abnormal growth in the breast. It's not just the breast. When we say the breast, it constitutes a whole lot of things.
Okay.
So we have the glands. That is basically where the breast cancer is situated. So that is basically breast cancer. Breast cancer is abnormal growth in the glands of the breast. That is breast cancer.
So if I get it very well, breast cancer is abnormal growth in the breast. So it means that every woman or every person with breast has potential risks of developing a breast cancer.
That is very true, but it varies from person to person and from gender. Women have a higher risk of getting breast cancer as compared to men.
Okay. Thank you. But let's ask again. What are the causes of breast cancer?
Hmm, this is a tough question, but I would like to break it down for our viewers so that we all really understand this.
Okay.
With cases like breast cancer and other non-communicable diseases, most of them do not have a known cause. Okay. So I cannot absolutely tell you if you eat yam, you get breast cancer. If you eat coconut, you get breast cancer. But I can tell you if you have an interplay of certain risk factors, but your basic risk of getting breast cancer is that you're a woman and you are more than 40 years of age. That is your higher risk. But there are other risk factors like weight gain. That is one. Number two is alcoholism. Excessive alcoholism, not just alcoholism, excessive alcoholism. Smoking, use of certain hormonal drugs, in coming into contact with radioactive radicals that can also influence your risk. Remember, if not only one of this risk would make you prone to the disease, it's an interplay, as I already said. So 2 or 3 of them would make you a high risk or at high risk or at high prevalence of that disease.
Okay. Thank you very much, Patience. That's very beautiful. So we know from the beginning that breast cancer is abnormal growth in the breast, and then also we talk about, she just finished talking about how, or the causes, which she stated clearly that there is no definite cause that is breast cancer, but an interplay of different
Various risk factors.
Yes. So okay, since there is no really one cause of breast cancer, there certainly might be a way that we can be preventing breast cancer. So tell us, how do we prevent breast cancer?
Breast cancer can be prevented as a lifestyle practice, as a day in, day out practice, since most of the risk factors are lifestyle practices.
Okay.
You reduce your intake on alcohol, you
Okay.
eat well, you exercise to reduce the weight gain,
Okay.
you reduce your exposure to radioactive radicals, and you cut down on hormonal use of certain drugs.
Okay. Thank you very much. Then the final question before we exit this studio here. How can, or what is the role of men in helping their partners not to get breast cancer?
There are a few things a man can do, since most of the activities are personal and lifestyle based.
Okay.
You can influence your woman with a little bit of jogging per each week you do with her. You do the examination with her, and in case you notice any changes in the breast, you can also prompt her, or you would serve as a support system for her, since you are in a relationship, obviously, your
Okay.
boyfriend or your husband. You can go along with her to do the checkup once every year, which will be a very good help to her.
Okay, you mentioned examination. How do I examine my partner's breast to know that she is probably developing breast cancer, or ensure that she is free from breast cancer?
Most ladies know how to do the examination, but I will just talk about it briefly. Since if it's not done pictorially,
Okay.
most men cannot learn. But briefly, you can notice when you go circular motion around the breast, circular motion just
Okay.
around it, you might feel there are a bit of spots in there. So when you realize there are a bit of spots in there, you try and alert her. Or maybe you might physically observe that one breast is bigger than the other. Normally, all breasts, one is bigger than the other. But when it is abnormal and there is a bit of alteration in the skin, you can identify that and prompt her.
Okay. Um, Viewers, that hand should have been my hands going the circular motion, but
it was to me as well.
but there's a certain gentleman behind the camera who is trying to distort everything here. So, what are some of the myths associated with breast?
Cancer. My viewers would know a whole lot of them, but I would just like to mention a few. Somebody told me recently that when you bite the nipple, you get breast cancer, or it's spiritual, or FIFA before a cheer. But that one is not the cause. Those are myths. When you find out you have a lump, I would like to encourage all of my ladies to immediately rush to the hospital. You can get a spotting here and there for a month. It is supposed to go off within a month, but when it is more than a month, immediately report to the hospital. It is not scary, it is treatable. If detected early, you can treat it, you'll be fine. So don't be scared. And nowadays, because of technological advancements, there are better ways to manage breast cancer. And I would like to also encourage my ladies out there, when you give birth to your babies, please and please see to it that you do effective breastfeeding for the children. It really lowers your risk of breast cancer.
Okay, that's perfect. And then also, I want to add that people who, by virtue of developing breast cancer and their breast have been cut off or has been worked on as a matter of that, please let's limit stigmatization or trying to make them feel bad. It's not their fault developing that or something that happens to them, and it could happen to any other person. So if you come across someone who has no breast as a result of suffering from breast cancer, be very nice to that person, and then be very nice to that person.
Very nice. It will even expand her lifespan.
Yeah.
And it will even encourage other people who are in those conditions to remove certain ideologies from their heads. Because getting the treatment is the most important thing. Your life is the most important thing.
When we stop stigmatizing people, it's going to help people who already have the breast cancer and stand at the chance of being worked on. Okay, they can also get that help and live longer. But if we stigmatize people, people will not be encouraged to go through treatments and maybe get their breast cut off for them to live longer. And I definitely know that cancer can spread
throughout the whole body.
Yeah.
So breast cancer can either be benign or metastatic. It can spread throughout your whole body, which will at the long run escalate into your death. So when you start with a benign one, quickly report to the hospital. When you report earlier, your life can be saved. I'm begging you. So please report to the hospital earlier, and we will continue to advertise the reporting to hospital early. Don't think about the cost, because we came to meet money and we'll leave money here and we'll die and leave it here. So don't think about the money too much. And nowadays it's cost efficient and the procedures are safe, and we can assure you it's safe.
Okay.
It's safe when you report early. Taking breast off was a thing of the past. Now we don't take breast off unless you stay home for a very long time. That is when you are going to take your breast off. But now we don't take the breast off. We just pick the cancer out and the affected tissues out. That's all we do. You can still have your boobs there. Currently, globally, there is 7.6 women as of 2020 diagnosed with breast cancer. 7.6 million women 2020 by WHO, and about 656,000 deaths have been reported. All the rest are currently there living their lives, and you can be one of them too. So don't lose hope.
Alright, so please take this education very seriously, and then also stay safe out there. Thank you so much for coming, patient Otoo, a health worker and also a fashion designer.
And an event planner too.
And an event planner as well. Oh, that's beautiful. I would have to buy some of your beads. Okay.
Seriously.
When I find a girlfriend, I'll buy some for her to put on her waist.
Are you sure you have a girlfriend?
Oh. Cameron, do I have a girlfriend? Tell her if I have a girlfriend.
Oh, come on, tell me.
So thank you so much for watching this up to this point, and please don't forget to subscribe to MorlaXorla. We're on Facebook at MorlaXorla and also on Twitter, MorlaXorla. Thank you very much, and stay safe. Bye-bye.